This is the abdominal assessment. Hi, my name is Sarah. I'm your nurse practitioner student. Just going to take a look at your abdomen and do an assessment. Is it okay if I pull your shirt up?
Yes.
Okay, I'll keep you covered here. So first we're just going to take a look at the abdomen. We're going to look at the shape, skin color. It's normal for ethnicity. I don't see any scars. No aortic pulsations or peristalsis. The umbilicus is midline. I don't see any protrusions or hernia. Next, we're going to take a listen to bowel sounds on all 4 quadrants. Bowel sounds are present in all 4 quadrants. Next, I'm going to take a bellow of the stethoscope, and we're just going to listen for the aortic artery. And we're going to go for the iliac artery. I'm going to go back up and listen to the renal artery because I forgot that. I'm going to come down and listen to the femoral arteries. And no bruits are present, so that is normal. Then we're going to listen to for venous hums and friction rubs over the liver and the spleen with the diaphragm. No hums or friction rubs. Next, we're going to do percussion. We're going to do in all 9 quadrants. I'm just going to do some light tapping on your belly. Okay, you can hear the dullness over the liver and the tympany over the spleen. Next, we're going to measure the span of the liver. So we are going to go to mid-clavicular, and then we are going to come up, down actually. And so that right about there, and then we're going to come back up. You can hear the dullness over the liver. I would say it's about 6 centimeters, which is normal. And then we are going to measure the span of the liver. We're going to assess for an enlarged spleen. So percuss the anterior. And you take a deep breath. Okay, all right. And again, I hear the dullness over the spleen because it is a organ and it's a solid mass. So we're going to palpate. We're going to start with light palpation. First of all, do you have any tenderness in your belly? Okay. If it was tenderness, I would wait and do that one last. Just going to do light palpation. No masses or abnormality noted. And then we're going to do a deep palpation. We'll do this one just a little bit harder. Press down. Any tenderness there? Okay. So if there was rebound tenderness, then I would press down slowly in the area and then release quickly. Again, like I said, there's no masses or anything like that. If so, I would describe them, location, and where those were. So to palpate the edge of the liver, I'm going to come down from the top. I'm going to hook around about underneath here, and I'm going to you can use scooping method to feel the liver about that area, and then you're going to come over here on the spleen, palpate. I do not feel the edge of the spleen or anything, so that is good. And then I'm going to feel the kidneys, so I'm just going to take one hand and then put it back here, and then if you could take a deep breath, and then I would repeat that on the other side, which is sort of hard to do over here. Okay, take another deep breath. Okay, and then on the aorta, deep enough with the fingerprint. Aorta is down in here. And feel the edges of that. Okay, we're gonna wait for the CVA to check for ascites. There's two different methods. You can do the shifting dullness or the fluid wave. So with the fluid, I'm gonna put it right here. You don't see that going anywhere. And then you can also take the patient's hand and you can put it around about at this angle, and then give it just a few minutes, and then you can percuss on that and see if the fluid waves over that way. You can also then have the patient to roll on their side over here, and then you can percuss on here. By that time, the fluid should have shifted upwards, and you can hear it sound that way. Okay, so there's no ascites present. And then for appendicitis, for the Rosersford sign, you will press on the left lower quadrant, and when you press in on that and then let it go, they should feel pain on the right side. The psoas is when you're going to, still in here, you're going to lift their left leg, straighten it out, and if they press down, they will feel pain in the right side where the appendix is, or then I can't remember what that one's called, obturator. And you're going to pull this up and then flex the hip and pull that way. They will feel the pain on that as well. And then for the cholecystitis, you're going to do the right upper quadrant. So you will palpate the edge of the liver and the right upper quadrant, and then they're going to take a deep breath. And then if the pain intensifies or they need to stop breathing, then that would indicate possibly cholecystitis or black gallbladder. And then you would make sure your patient's just covered back up. You would note your findings, any abnormalities or anything like that.